Hi, this is Don Nasca with Medicare Self-Help. This video will explain what Medicare Advantage is and what you need to look for before selecting a plan. I primarily want to impress on you that you need to compare apples with apples. Medicare is a federally managed program. Medicare supplements are insurance policies that pay on top of Medicare. And Medicare Advantage is a privately managed alternative to Medicare. Do not confuse them, because Medicare Advantage advertisements are not very clear on all these differences. If you are over 64 years of age, you are most likely overwhelmed with Medicare Advantage advertisements. Every single ad screams out the same mantra: get the benefits you deserve at no cost to you. This is just the package of, if I can show it, advertisements that I've received in the mail in the last few months. It's overwhelming. My purpose here is to help you make wise decisions about Medicare insurance plans. The only way anyone can make a wise decision about anything in this life is to understand the pros and the cons behind the decision. Handling every medical and pharmaceutical bill of 60 million American senior citizens over their final third of their lifetimes is worth trillions of dollars. Now, I'm not against Medicare Advantage as a product. Like any other product, there's a market segment that is best served by it and a market segment that is not. Every product has its pros and cons. Most salespeople are well versed in the pros and don't even learn about the cons. After all, it's our job to sell you a plan, not educate you about the disadvantages. Sadly, I have learned from my 40 years of business that as long as everything a seller says and prints is true, it is legal and not considered deceptive. It's up to you, the buyer, to beware and find the negatives that are not mentioned about any product. This gives the seller an unfair advantage, and a wrong decision on your part can result in a much higher out-of-pocket cost than you needed to pay. I present both sides of every story, the advantages and disadvantages of every product and service, so you can truly make the most informed decision and potentially save a lot of money, and I can sleep at night. This slide is a simple pictorial of how Medicare Advantage works. We pay taxes into Medicare our entire working lives. Few ever actually think about what Medicare is until we're 64 years old and the mailbox is full of love letters from Medicare-related marketing and salespeople, as I showed you. Medicare Advantage is entirely paid for by your tax dollars. Instead of paying your medical providers directly, like Medicare does, the money goes to a relatively small number of private insurance companies that organize their own network of medical providers. The insurance companies receive a monthly fee, regardless if you use a lot of services or none at all. The insurance company then negotiates prices with your medical providers and the pharmaceutical companies. Then you pay your providers whatever share of the costs your plan describes and any premium required. After 1 year of enrollment in Medicare Part B, each enrollee is assigned a risk score, which represents your overall health condition and the estimated cost to provide the care you need, compared to a score of 1.0, which is the national average. The higher your score, the more the insurance company and your providers will get paid. Medicare Advantage was sold to our legislators as a means to better control healthcare costs and improve the quality of our care. In order to legally speak with an insurance agent about Medicare Advantage plans, you will be asked to read this table and tell the agent which one of these products you want to speak to them about. The full table is actually longer, as it includes Medicare supplement insurance, hospital indemnity insurance, and plans for dental, vision, and hearing. You can find the full document on my website, MedicareSelfHelp.com, under the name Scope of Appointment. Of course, very few people reading this would be able to tell which one is best for them, because this does not clarify the differences between the benefits and costs of each plan. Why anyone would choose not to learn about all options available to them is beyond me. The most common Medicare Advantage plans sold are HMO plans. There are also many PPO plans and some special needs plans, and a few HMO POS plans in our Portland, Vancouver market. At this time of this recording, there are no PFFS or cost plans in our area, and only one company sells MSA plans in Oregon and none in Washington. Market positioning is something you should understand. Medicare Advantage carriers and plans compete against one another in many ways, but there are 4 or 5 major areas to consider before choosing a plan. Of course, the primary benefits will be the hospital and medical benefits. All plans must cover the same benefits provided by original Medicare. What varies is the amount of coinsurance, copays, deductibles, premiums, and maximum out-of-pocket costs you will have to pay when you get ill or injured. What you pay out of pocket for each type of service can add up to a large sum called the maximum out-of-pocket. It is important to note that the premiums and any denied claims are not included in your maximum out-of-pocket costs. Your question should be, what will my current and future predicted usage of medical services cost with this plan? So every plan you look at, that should be the first and foremost thought in your mind. Unfortunately, that is not typically discussed when you're purchasing these plans. It's up to you to read each line item and to understand what coverages are and think about what your personal scenario may look like. And of course, none of us can know. We don't know what's going to happen to us in the future. The whole point of insurance is to cover the risks of the really bad things that could happen to us. Okay, the next is drug coverage. If you select an MAPD plan, which is the most commonly chosen Medicare Advantage plan, it'll be packaged with a prescription drug plan. Drug costs can easily become the most substantial cost of our Medicare journey. Drug costs are not included in the maximum out-of-pocket costs. The cost of your specific drugs absolutely must be reviewed. See my video on Medicare A, B, C, and D to understand how Medicare Part D coverage actually works. Your questions should be, are my current drugs covered and what will they cost? The next area is the provider network. Medicare Advantage plans require you to use their in-network providers. Choosing an HMO plan will limit your choices of medical providers. A PPO plan will allow you to go outside of the network but at a higher cost. If you need a specialist, Medicare Advantage HMO plans generally require your primary care physician to refer you to an in-network specialist. You may also be required to get pre-approval for anything outside of routine procedures, and the insurance company can deny coverage of any completed services they deem were not medically necessary. You need to ask yourself these questions. Are my doctors, clinics, and hospitals in the network? And does having a choice of doctors matter that much to me? Should I develop a serious illness like cancer, heart, or organ failure, do I want to choose a specialist myself based on actual reviews, regardless of where in the nation he or she is located? Or will staying in a prearranged network of doctors that may not be your first choice be sufficient? Do I want to wait to see a primary care doctor for a referral, then schedule another visit a referred specialist, and then wait again for additional pre-approvals for procedures, and then on top of it all, possibly have some of them denied? The next area to look at are the ancillary benefits. These do not come with original Medicare, and they're used to attract you away from staying on Medicare with a Medicare supplement plan. These are almost always the benefits that Medicare Advantage advertising focuses on. These benefits are only as valuable to the extent that they are actually available to you in your service area. Of course, they always mention the most attractive benefits, such as having your monthly Medicare Part B premium paid. You rush to call the toll-free number only to find out that benefit doesn't apply to you. The other decision criteria is to what extent will you actually use the offered ancillary benefits. It is wise to compare the cost of buying ancillary benefits such as dental, vision, and hearing coverage separately. Ancillary benefits should not be viewed as the primary reason for choosing to go with a Medicare Advantage plan. I will show you a list of the most common ancillary benefits on the next slide. Your question should be, will I use the ancillary benefits? What is their actual value to me? What would it cost to buy these preferred or my preferred ancillary benefits separately? Finally, there are some other factors which I show here, which you'll hear relatively nothing about, except for possibly the star rating, which is a complex rating system that Medicare uses after a plan is on the market for 1 year. And you can find these ratings on Medicare.gov. So each individual now must decide how to weigh each of these slices in determining the best plan for their needs and budgets. If you worked for a living and were covered by an employer HMO plan and a separate dental and vision plan, then you will understand these variables. The difference is our Medicare tax dollars are paying for some percentage of the coverage, not our employer. Here are the differentiators that I list. It's not all inclusive, but most of them are shown here. Every Medicare Advantage plan must offer the same primary benefits. But as I mentioned, they are not offering the same cost sharing. This means what you pay out of pocket can vary widely for the same services depending on the carrier and plan you select. Most Medicare Advantage carriers offer zero premium plans, which are obviously very attractive to anyone just focused on the monthly premium and not on what it will cost when they need medical services. Don't be fooled about those extra benefits into thinking the only differences between the Medicare Advantage carriers are the free ancillary benefits they offer. Next, we'll move to some major considerations which I'd like to highlight. There are 3 of them. Now that you have a good idea of what to consider when choosing a Medicare Advantage plan, the next thing you will need to understand are the points that are not so obviously stated. Depending on your future health, something nobody can predict, Medicare Advantage can either save you money when you're healthy or cost you more than other alternatives when you're ill. Our most valuable Medicare right is our guaranteed right to issue. This comes into play if you wish to return to Medicare and buy a Medicare supplement plan in the future. Please watch my video on Medicare supplement policies to better understand this point. If you stay enrolled with a Medicare Advantage plan for over 12 months and you find your costs have exceeded what a Medicare supplement policy would have cost you, you would have lost your guaranteed right of issue for a Medicare supplement policy. This means you will have to pass a health screening for pre-existing conditions should you wish to return to Medicare with a Medicare supplement plan. Washington and Oregon are accept or deny states. This means your answers to the medical questions on the application can result in denial of the Medicare supplement policy. The questions you should ask: will I be eligible to purchase a Medicare supplement plan should the need arise? Will denial and potentially spending the Medicare Advantage maximum out of pocket for several years be a financial burden for me? Obviously, these questions get lost in the sales pitch of zero premium and ancillary benefits that you deserve. Point number 2 are the true out-of-pocket costs. Medicare Advantage marketing and sales really make no attempt to inform you of your realistic out-of-pocket costs. Medicare.gov attempted to provide a calculator in 2018 and has since become quietly removed without comment. Anyway, your out-of-pocket costs can vary significantly depending on the plan you choose, regardless if the premium is zero. You should note that the MOOP increases every year. So in 2022, the HMO plans have a maximum out-of-pocket cost of $7,550, which is equivalent to $629.17 a month. PPO plans are obviously more expensive. They're up to $11,300 in maximum out-of-pocket costs, which is equivalent to $941.67 per month. This does not include your out-of-pocket drug costs. According to the Commonwealth Fund, which you can Google, the average out-of-pocket cost in 2021 was $5,343, which is equivalent to $445.25 a month. This is actually more than you would pay for a Medicare supplement plan combined with a standalone drug plan, a dental, vision, and hearing plan on top. You won't find any of this info in Medicare Advantage marketing material. Imagine you get ill late in the year and hit the MOOP and remain ill the following year. You could hit the MOOP twice. That would be $15,100 with an HMO plan and $22,600 on a PPO plan. The questions you need to ask are: what happens if or when my health drastically changes? Will my budget cover potentially having to pay the maximum out-of-pocket costs? The next item to cover is the third and not least significant item by any means, are the high cost share items that you may end up with when you get ill or injured in the future. Should you require any of these services, Medicare Advantage will cost you considerably more than just staying on Medicare with a Medicare supplement policy. The items you need to pay attention are those where you have to pay 20% copay or co-insurance, I should say, meaning that whatever the bill is, you're paying 20% of it. If you're on a Medicare Advantage plan, have concern about these illnesses, you can purchase a separate insurance policy to cover a variety of critical illnesses such as cancer, heart attack, stroke, or major organ failure. You can also purchase a hospital indemnity plan, which basically pays for the typical $1,600 to $2,000 or so dollars you'll be billed for the first several days that you stay in the hospital when you're on a Medicare Advantage plan. A case for Medicare Advantage. I may sound negative here. It's not meant to be negative. It's meant to be informative. I don't want to leave out the cons. You can find the pros. You want to find the pros, look at your advertisements in the mail or watch television. You'll find nothing but pros, not a negative in here. My job is to sell you something that I can sleep at night after I sell it to you. In making a case for Medicare Advantage has low premium, even zero premium plans. They generally come with prescription drug plans, a number of ancillary benefits. They'll include things like dental exam, cleanings, eye exam, discounts on glasses, hearing aids, gym memberships. Some cover over-the-counter drugs. There is little doubt that a healthy senior that requires little need for medical services will save money and enjoy more benefits on Medicare Advantage plan while they're healthy. If your income won't allow you to pay a premium of any amount, then of course, if you're going to be in a significant burden paying a premium, Medicare Advantage will be the lowest cost alternative to receive benefits that are above and beyond your standard original Medicare. I mean, there's no reason not to sign up. It's free, right? It's only going to cost you when you go to the doctor or need a service. Lastly, some Medicare Advantages offer special needs plans, which are for consumers with chronic illnesses and also folks with low incomes and low assets. They have special plans. These can be quite generous in benefits and are certainly worth looking into. And my final comment here is that an independent agent like myself will always do his or her best to show you a wide range of plans that address your specific needs. An agent that works for a single company on a toll-free number absolutely cannot do this, and they're not allowed to do it. They would be fired. So anyway, this has hopefully been informative to you on Medicare Advantage plans. I'd like you to put your camera over the little symbol. It will take you to my website, a little pop-up you can click on, take you to my website. You can set up an appointment with me, no charge. We can speak with 5 minutes or an hour. It makes no difference. Happy to help you out. You can also send me a form. You can send me your information to contact you. You can send me an email or just pick up the phone like the old days. That's what we used to do all the time, right? We didn't have all these tools. So anyway, I hope it was informative to you. You learned something, and please reach out to me again. My name is Don Nasca. I'm with Medicare Self-Help. Thank you.